I'm not actually going to be talking about happiness. I'm going to be talking about AIDS. This is HIV. This is the virus that causes AIDS. Now imagine if you live here. This is Western Zimbabwe, and your body is full of millions of that virus. And the nearest clinic is about 70 miles away. And about 70% of those affected by AIDS in Africa live in places just like these and virtually have no access to treatment. So how can we change something around this? How can we do something about this? Well, everything actually starts with testing. If you can just get testing going, this has huge impact. If you're positive, it gets you onto treatment. It stops you, it reduces rather the chance of you infecting other people. If you're negative, it starts the process of changing behaviors that may put you at risk. Basically, everything starts with testing. This is one of the first groups we worked with in Zimbabwe. And I know they look healthy here, but this is one of the things about the disease. You don't know that you're infected with it until the damage is well underway. When we started with this group, virtually no one had tested. Essentially a baseline of 0 in terms of numbers of people who had tested. When we looked at other programs and in the literature, we expected that we would be doing well if we could get about 30 to 40% of participants on the program to actually get tested for HIV. And here's what actually happened. Over 85% of people that worked with us on the program, 85% of participants tested in the first round. And when we went back later in subsequent rounds in the next few months, we got virtually up to 100% of people testing. This was a really big thing. So somehow we had figured out how to get people to go and test for HIV. What we found was that even in areas where people were reluctant to go and get tested on their own, that if you put them in a group and you asked the group to test, that they would. So that the point here is that if you want to get people to test for HIV, test them in groups. Now, testing doesn't just influence individuals. Testing influences entire communities. It starts to change the way that people think about HIV in that community. It also raises awareness. But everything starts with testing. Here's one of the big problems in the areas that we work. How do you reach people in remote places? Well, we found that the best way to do this was to rely on organizations that were already there. So we have a kind of a Coca-Cola distribution model to get to hard-to-reach places. For example, we partner with wildlife conservation organizations, hence the link with the name, and we leverage their resources, and particularly the way that they're integrated into local communities to kind of get the ball rolling. Communities are made up of different groups. And if you want to have any real impact on the epidemic, you need to have a menu of programs that are tailored individually to each one of those particular groups. So what we do is we connect up with other organizations, each doing a piece of the HIV puzzle, and we create a network of providers. So for example, this is Mothers to Mothers. They specialize in the avoidance of HIV-positive mothers infecting their infants during the birthing process. Or Grassroots Soccer, who work with kids around AIDS using soccer as the medium of instruction. Another important part of this is working with state providers that may be on the ground in this particular area. So, imagine what could actually happen if we get all of this right. People could know their HIV status. People who need treatment get treatment. No HIV mothers infect their infants. School kids know about HIV. And new infections are dramatically reduced. So if we do all this, if we can actually make this happen, we can stop the epidemic in a particular area. And everything starts with, my work is done. Thank you.